Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. Emergency medical services is our topic today because this week is National EMS Week 2013. I'd like to pick up right where we left off by welcoming back my next guest to the program, a very familiar face, Mr. Kirk Schmitt, EMS, Monterey County EMS Agency Director. Welcome back, Kirk, and thank you for joining us for round two.
Happy to be here.
Still happy to be here, right?
Absolutely.
Excellent. And maybe I should call you Dr. Schmitt for this section because we're talking about emergency medical.
No, unfortunately, our medical director was unable to be here, so I'm filling in for him. So hopefully I can speak as well as he would have.
Well, thank you. And really, thank you again for filling in at the last minute here.
No worries.
So let's talk a little bit about the history of EMS. Where did emergency medicine come from, and EMS in general? How did this come about?
Sure. Well, EMS has been around for a long time. You can actually go all the way back to the Civil War and Florence Nightingale, if you will. There's always been this sort of out-of-hospital delivery of medical care. But really, EMS came about in the 60s. But before I get to the 60s, we got to talk about a little bit before the 60s. So after World War II, most of the time, when somebody had an emergency, a medical emergency, typically the funeral home would respond.
Ooh.
And I'm not talking about a medical emergency for the living and not the dead. So, and the reason why that was in the 50s and so is because they had the vehicle where people could lay down.
Oh, that is so interesting.
It's interesting.
It's a hearse, yeah?
It's a hearse.
Oh.
Or an ambulance when it was going to visit the living and not the dead. So was the typical response, and the people who went had some first aid training, but not a lot of training. The morticians and the funeral home directors knew some basic first aid, knew anatomy very well.
Okay.
So they could respond. There was no 911. It was a 7-digit number. But now we get to the 60s. So we had the Vietnam War occurring, and where they were really discovering, first they discovered a little bit in the Korean War, but mainly in the Vietnam War, that there was a real benefit to getting treatment to the injured right away. This is where the term golden hour came from, was sort of developed under the trauma of war, and if they could get treatment within that hour, they saw better positive outcomes.
Oh.
So on the civilian side, in 1966, a white paper was written that, well, we call in the business, the slang of the title of this was Death in the Ditches, which essentially was a white paper that said this delivery of care pre-hospital needed to be organized in a fashion so that it could actually elevate and improve the outcomes of people who were injured on the roadways of the U.S. So that led to the development of the certifications, what I discussed in the last segment, the emergency medical technician, paramedic, and a couple of others. Their emergency medical technician who did IVs and such. And in California in 1980, they developed an EMS Act that sort of organized the whole delivery of care of EMS under a state agency, the EMS Authority, and then also made sure that locally, county EMS agencies, which I'm the director of Monterey County, were formed so that we could organize the care in the county, and then the state made certain that the care delivery was uniform across the state. California's a big state, so uniformity isn't perfect, but there are at a minimum and a baseline, there is a lot of uniformity to delivery.
Wow, so we date back here to, you said, Civil War times.
Certainly.
And then really getting organized like in the late 60s-ish.
Yeah. So EMS is, as a profession, as a career, really is only about 45 years old.
Oh, wow. So I have to ask, how did you get involved in this? Now, you mentioned something about William Shatner when we talked offline about
Unfair.
earlier.
So there's really two iconic programs in the world of EMS. So in the 70s, there was a program called Emergency that sort of followed two paramedics with the LA Fire Department, Johnny and Roy. So they were the 60s version, and then in the early 80s there was a show that was hosted by William Shatner, who did reenactments of rescue calls. It was called Emergency 911. It was in the mid-80s. I'm dating myself, giving my age here a little bit. But this show was out in the mid-80s, did a lot of reenactments of ambulance calls. And I found it very interesting, fascinating. I was not in the field of EMS at that time. I was actually in the printing industry. Huh. But I found it fascinating, and I thought, why not? I'll go do an EMT class, and I did in Black Duck, Minnesota, many, many years ago.
Wow.
So that was my entry into EMS many years ago.
Well, thank you for that. Found that kind of interesting about you. So let's get back to the medical bit here. What's the difference between emergency and non-emergency medicine?
Well, that's a hard question to answer, but when you dial 911, you've dialed it because you have a perceived emergency.
Right.
Your emergency becomes our emergency. So we're going to, when I say our, I mean the EMS system. So we're going to respond, we're going to evaluate, and typically, or almost always, universally, if there's a transport that you need to go to the hospital, you need to receive treatment, you're going to go to the emergency room. So that's the 911 makes it an emergency, and that's an emergency treatment that occurs. But there's a large portion of the EMS ambulance transport business that's non-emergency. So these are the things that occur where it's a transfer from a hospital to another hospital, where you need to move a patient for a different type of care to another hospital, or maybe it's returning a patient from a hospital to a home, a nursing home, or the flip side, it might be a scheduled transfer from a home or a nursing home to a hospital or a clinic or a doctor's office for care. It becomes the non-emergency. Again, we have EMTs and paramedics who can provide the care and provide the oversight, and that's why they're there. But it's really about a transport to get patient from point A to point B with a medical oversight.
Okay. So as an EMS director, Dr. Stubblefield, who was going to be here today, would probably answer this question.
Sure.
But I'm going to ask you instead. So what are some of the responsibilities of the EMS director?
Of the EMS medical director?
Or, excuse me, EMS medical director, yes.
Well, first off, the opportunity for our first responders, our EMTs, and our paramedics to provide the care, it's done under delegated practice, meaning they get to provide that care, or they're allowed to provide that care because they have a medical director. And our Dr. Stubblefield is our county medical director. So first off, he provides the oversight to allow them to provide care. But in providing oversight, he does it not through direct conversation, but by development of policies, procedures, and protocols.
Okay.
Essentially the rules by which they provide treatment. So a first responder or an EMT or a paramedic is sort of escalating rules. So a first responder has a smaller set, an EMT a little bit more, and then a paramedic has this bigger set, the bigger scope. So that's his primary mission, is to make certain that the policies, the procedures, the treatments, the protocols, all are up to date, current, make sense, and that they are appropriate for the citizens of Monterey County. At a state level, they provide some guidance as to the scope that a paramedic can practice, or an EMT can practice, or a first responder can practice. And at the local level, under Dr. Stubblefield's purview, is he makes sure that scope is accomplished.
Okay, and so by policies and protocols, you mean something like if this is happening to someone, then you do this, and then if that happens, then you do that, and then, or if this happens, then you go. Right. It's kind of like a really in-depth flow.
Right.
I'm thinking of flow chart.
Well, that's correct. Is that it's a recognize the type of injury, illness, or disease that they're seeing, and here's the parameters and how you treat. Now, what's unique about EMS or the medical field is it's more art than science. So while we can write very detailed treatment pathways for how to treat patients, unfortunately the patients don't fall right into that perfect little box. So this is where our first responders, our EMTs, and our paramedics have to utilize their training, their education, to recognize how to move the patient into the box, if you will, so that they can provide the treatment. And then as the treatments are occurring, there may be results or unintended consequences that may make them change into another. So it's a very fluid process. You've seen one patient, you've only seen one patient. Every patient can be a little bit different.
Yeah, that must be very, I don't know, I'm thinking about all these protocols, all these, papers, or I don't know,
Right.
Do you write them out, or are they diagrammed?
They're written out.
Okay.
We have quite a few, a very comprehensive treatment book that we're trying to capture as many of the different variables as possible. But the reality is we'll never capture them all. And the training and education and the continuing education that all of our providers, roughly 700 EMTs, about 300 paramedics within our system,
wow.
and probably 200 first responders, maybe a little bit less. Their education and their continuing education supplements those treatment pathways or treatment patterns, so that they can function.
Yeah, it sounds like not only the education, but the creativity too. Like you mentioned, it seems like an art. I mean, it could be a what if gamer's fantasy. What if this happens? Then what do you And
right.
I feel like there must be a binder somewhere, a huge binder, where you.
There is.
Are people flipping through and saving lives, or how does that?
There is a large set, a large binder, but it's our expectation. Ours being the EMS agency, our expectation is that when they're in front of a patient, that they're not flipping through the book, that they intuitively know through their education, their training, their experience, that they intuitively know most of the treatment. That book is really a reference material for prior to calls, that they can go and sort of fine-tune their knowledge. And then after the call, they can go back and revisit and see if there was something in their treatment in the treatment they did that may not have worked out just right. They can go back and look and see if there's something in our treatment pathways to see if they're educate them for the next patient.
Gotcha. So you can kind of do like a review of what you
Absolutely.
and see how you measured up to the protocol, or see even how the protocol can be changed even. Do people make recommendations to change protocols?
Absolutely. So we have a medical advisory committee, which is a subcommittee of our emergency medical care coordination committee, which is appointed. That membership of the EMC is appointed by the Board of Supervisors.
Oh.
It's 13 members who make up the stakeholder groups of our EMS system. So we have citizen representatives, we have city representatives, we have fire representatives, et cetera, law representatives. Then a subcommittee of that is our Medical Advisory Committee, which Dr. Stubblefield chairs,
Okay.
which is made up of mainly providers. So we have all 4 hospitals represented there, both ED physicians and ED charge nurses, emergency department charge nurses. We have paramedics, we have EMTs, both from AMR and from our other providers. And they essentially provide guidance to Dr. Stubblefield as to what they're seeing in the field, as to what they're seeing in the field and what's happening in the world of medicine, what new things are happening. And they work together in a coordinated effort to refine our medical treatment protocols in a very sort of comprehensive way. And we review and change them twice a year. Wow,
so that's a huge job too. For Dr. Stubblefield's got to kind of connect those dots and make sure that they're always connected. And is he responsible for brokering the relationships as well with other first responder agencies, or it's a pretty tightly knit network here?
That is correct.
Okay.
And he provides leadership and guidance, and from he has some brokerage connection. The EMS agency is essentially that broker. That's what we do, is make sure our small group work with all of our stakeholders to get consensus and to make certain that the other trick to all of this is we have state statute and we have scope and we have these Medicare, Medicaid, and all these healthcare laws that that have a pre-hospital component to them. We have to make sure that we're within the boundaries of everything, and so we broker it. That's what we do.
Wow. So I think we have time for just one more question,
Sure.
and that is, what is happening at the Health Department, 1270 Natividad Road in Salinas on Wednesday the 22nd? Well,
Again, this is EMS week, one mission, one team. And on Wednesday, we are hosting an opportunity for our first responders, our fire departments, our ambulance services to bring their vehicles, to set them up in our parking lot at 1270 Natividad Road, and invite the public to come and check it out. Look at the vehicles. You'll get an opportunity to look inside the ambulances, look at fire trucks. We're going to have helicopters there.
Ooh.
So you'll have an opportunity to look inside the helicopters. But what really is important is for the public to come and say thank you. That this group of people, they do this every day. And this is our opportunity to thank them for what they're doing. It's an important job.
Definitely, saving lives
Absolutely.
every day here. So what time real quick is that going down?
From 10 a.m. to 1 p.m. at 1270 Natividad Road in Salinas.
Thank you so much, Kirk. You know, it's about that time. I want to thank you again for taking the time to be with me today and talk with us and our viewers. And as always, it was great talking with you and learning from you as well. For more information on Monterey County Emergency Medical Services Agency, please visit the EMS agency online at www.mtyhd.org/EMS. Right now we're going to take a short break, but don't go away. We'll be back with more of the Your Health television program in just a moment.